Hello and welcome to our module on autonomic nervous system drugs targeting the acetylcholine receptor. All right, here's our outline. We're going to talk about receptors that are found in the parasympathetic nervous system. Then we're going to talk about drugs that stimulate those receptors, and then talk about drugs that inhibit those receptors. While we're going through these drugs, it's important to keep in mind that a lot of these drugs will come in later organ modules. So just try to memorize as many of them as you can for now, and they will be reported and incorporated in a more systemic feel as you go on through medical school. All right, the parasympathetic nervous system is the part of the autonomic nervous system responsible for rest and digest. Just think about how you would feel at the end of the day after a big meal. That's exactly what the parasympathetic nervous system makes you feel like. And it's not important that you know every single individual muscarinic receptor, just know the overall combined effect of all of them. But I have them listed over here for your convenience. All right, starting with the M1 receptor. The M1 receptor is found mostly near sphincters and they help relax. This just helps in removing digested waste. Usually after a large meal, you want to help digest and just move through your GI system. The next place you would find it is the enteric nervous system. This just helps with peristalsis, which just helps move the digested food through your GI system. Moving on to the M2 receptor, M2 is going to be found in the heart and the blood vessels. In the heart, it causes it to beat slower, and that just means that you don't need as much blood when you're relaxed. In the blood vessels, it allows it to dilate, and that just means that you get more blood going into the organs, your digestive organs, so you can more efficiently absorb all the nutrition that's coming into your body. All right, moving on to M3 receptors. M3 receptors are pretty much found everywhere else. You can find them in the eye, which causes constriction of the eye. That's what we call meiosis. You can find it in exocrine gland, which help with digestion. They release enzymes into your GI and help with digestion that way. It can also cause bladder contraction, which allows you to urinate. Bronchoconstriction. Bronchoconstriction just means you just don't need as much air going into your lungs when you're relaxing. The best way for you to learn about what would happen when the parasympathetic nervous system goes out of control is this mnemonic called dumbbells. And it just gives you an easy way to memorize all of the effects of the parasympathetic nervous system. One of them is diarrhea, urination, muscle weakness, bradycardia, emesis, which just means throwing up, lacrimation, and salivation. So whenever you think of parasympathetic nervous system, whatever is making it wet and dirty and slow, that's exactly what the parasympathetic nervous system is doing. Now let's talk about the parasympathetic nervous system receptors. They're also known as muscarinic receptors, which sound like muscles to me. So I remember the mnemonic muscles kick. And once I know that, I can pretty much memorize the G proteins associated with every receptor by just memorizing the word kick. Now, once you know this mnemonic, you can pretty much guess that M1 is going to be a GQ receptor, M2 is going to be a GI receptor, and M3 is going to be a GQ receptor, kick otherwise. I want you just to keep in mind that whenever I say GQ, I mean that it's going to cause an increase in calcium. And this increase in calcium does one of two things. It either causes vesicles to release in the exocrine or endocrine fashion, and it also causes contraction. So these are the two things that you would expect a GQ to do. Now GI is more inhibitory in nature. So if you see a GI, you would expect it to inhibit the heart rate, and it'll also inhibit smooth muscle contraction, i.e. causing relaxation. With that in mind, I've got this picture over here. It shows you how it would work. You've got a GQ receptor right over here. The GQ will cause an increase in IP3. IP3 causes a release of calcium from calcium storage, usually something like an endoplasmic reticulum or a sarcoplasmic reticulum. This calcium will actually then go and it'll trigger other channel gates, and the gates will actually allow more calcium to enter. So the overall effect is you have more calcium, vesicle release, and muscle contraction. M1 receptor is often found in the central nervous system, and you would expect that drugs targeting this would have an effect on memory, is what we believe. And so a lot of Alzheimer's drugs will be used here. They can also be found in the enteric nervous system, causing stimulation of the GI. M2 is going to be found mostly around the heart and the blood, and this just helps us with reducing the heart rate and increasing blood to the internal organs, the GI area. Finally, M3 is going to be found pretty much everywhere else. You'll find it everywhere from the exocrine to your lungs to your pupils, and it just does what we talked about before: bronchoconstriction, pupil constriction, and exocrine secretion of the enzymes in your GI tract. You don't really need to know what each individual one does, just know the overall effects of them combined. All right, let's move on to cholinergic agonists. These are drugs that target the parasympathetic nervous system's muscarinic receptors directly and cause stimulation. Right off the bat, I'm going to let you know that the most commonly asked question on tests is going to be, what's the adverse effects of these drugs? And it's pretty simple once you have the dumbbells mnemonic memorized. Dumbbell stands for diarrhea, urination, muscle weakness, bradycardia, emesis, lacrimation, and finally secretions and sweating in general. So if they ever ask you what any of these drugs over here cause, you just remember the dumbbells mnemonic, and if one of them is a choice, then that's it. The first drug that you need to memorize is going to be bethanechol. Bethanechol kind of sounds like nature's call, and if you guys understand what nature's call is, it just means that you need to use the bathroom. And bethanechol can be given to patients after surgery because usually the anesthetics cause something called ileus, which just means your GI is kind of paralyzed, and it can also cause urinary retention. You can't really release your sphincters and urinate. All right, now carbachol. Carbachol is going to be read as carbon copy of acetylcholine. This one is used in eye droplet form to constrict pupils in the case of glaucoma, either open angle or closed angle glaucoma. You haven't taken this yet, but in neuro you're going to learn that glaucoma, all that is where your iris is overdilated, and this can cause a lot of problems with drainage of fluids. The fluid that's supposed to be draining on the side over here can no longer drain. So what carbachol does is, once we put the drug right here, it's going to just help the pupils constrict. And once the pupils constrict, you've got this nice area right here, which allows the blood to flow out of your eye and relieves glaucoma. All right, moving on to methanechol. This is how I read it, is going to be marathon running. It kind of looks like marathon to me. And the reason that I read it like that is because I imagine myself after a marathon, I'm going to be completely out of breath. And that's exactly what it does. It causes constriction of your bronchioles, and this can pretty much be used for screening of asthma. Some people, when you're testing for asthma, they're not necessarily having an asthma attack right now. So later on in PULM, you're going to learn that methanechol can be used to stimulate bronchoconstriction, and you can pretty much give the patient an asthma attack right there in your office to diagnose him with asthma if needed. All right, moving on to our final cholinergic agonist, that's going to be pilocarpine, and I read it as pilocarpine because I want to remember this mnemonic over here. You cry, drool, and sweat on your pillow. And this just helps me remember the adverse effects of pilocarpine that is going to be very similar to the dumbbells mnemonic of generally all direct cholinergic agonists. Pilocarpine is just used to constrict the pupils and the ciliary muscles, very similar to carbachol, and this can be used to treat glaucoma. All right, let's talk about cholinesterase inhibitors. But before I can actually do that, I have to talk about cholinesterase. Cholinesterase is an enzyme that's found in the synapse of the parasympathetic nervous system, and all it really does is it breaks down acetylcholine, and it just prevents the buildup of acetylcholine. So you could imagine if you inhibit the cholinesterase, you would get an increased amount of acetylcholine in the synapse just because it's being built up, and there's nothing there to really break it down. Now, why would we want an increase in acetylcholine in our synapses? Well, there are a few diseases that could benefit from this, one of them being Alzheimer's, which is just believed to be a decrease in acetylcholine in the brain. Another one is going to be myasthenia gravis. Myasthenia gravis just happens when antibodies in your body, like this one over here, starts targeting the receptors. So you have less receptors available. A way that you could fix that is just by helping it increase the acetylcholine in the synapse, and maybe you could stimulate the ones that are still available. Finally, another use for it is going to be atropine poisoning. If you know what atropine is, it's found in a lot of nightshade, a lot of poisons that are found in nature. And if you see a patient with atropine poison, we'll talk about it a little bit later, it's appropriate to give them an acetylcholinesterase inhibitor as treatment. Cholinesterase inhibitors have many drugs, including donepezil, galantamine, and rivastigmine. How I remember that is going to be Al's Gala to reverse the stigma by doing puzzles. Now, just imagine Al's Gala is being a gala for Alzheimer's disease, and they're just old people working on puzzles. I got this from Sketchy Farm, and it's really stuck with me. This is pretty much a great way for you to prevent acetylcholine breakdown inside of your brain. So this can cross the blood-brain barrier, and it's a very good treatment for Alzheimer's. All right, moving on to edrophonium. Edrophonium, I remember it by just reading it as short phone call connection, and that's exactly what it does. When a patient has myasthenia gravis, all that means is that they have antibodies that are targeting the acetylcholine receptors. So what you want to do is you want to give them edrophonium. Edrophonium was going to inhibit the cholinesterase for just a few seconds. It just only takes a few seconds, and that causes a sudden increase in acetylcholine. And the sudden increase will pretty much cure the patient from myasthenia gravis. So they'll go from ptosis that you see over here, they'll just look completely normal just for a few seconds, and that's how you can diagnose them. And once you've diagnosed them, you could pretty much give them treatment for the myasthenia gravis. The treatment is going to be pyridostigmine, which we're going to talk about a little bit later. Moving on to neostigmine. This neostigmine is going to be used predominantly as a post-operative. What it really does is it increases acetylcholine in the periphery, and this is just because during surgery we give them a lot of muscle relaxants. So they tend to be paralyzed for several hours after surgery, and neostigmine can help with that paralysis. Moving on to physostigmine. Physostigmine is very important because what you need to know is that it's got a physiology, physo, that's very different from the other ones. It can cross the central nervous system. And this is very important for atropine poisoning. So if someone ever tells you, what are you going to use for atropine poisoning, they might give you neostigmine and physostigmine in the choices. But you have to remember physostigmine wins every time because its physiology allows it to cross the blood-brain barrier. So you pretty much fight the atropine, even the ones that got into your brain. Finally, one that's also important for the neuromodule is going to be pyridostigmine. Now, pyridostigmine is going to be a more long-acting acetylcholinesterase inhibitors, and it works predominantly in the periphery, in the peripheral nervous system. So it's perfect for myasthenia gravis. It's exactly what edrophonium does in a few seconds, but this time you can only give it to the patient, and it'll work 1 or 2 pills a day. All right, moving on to irreversible anticholinesterase inhibitors. These are going to be found in 2 different areas. That's going to be insecticides like parathione and also in sarin nerve gas. So another name for these irreversible anticholinesterase inhibitors is organophosphate. That's important to remember. The populations at risk is going to be farmers. So I showed you a picture of a farmer spraying insecticide on his crop, and also people of war-torn areas. It's coming up in the news again with Syria, and some people believe that sarin nerve gas. As you could see, this patient right here is very sweaty and seems very flushed. It looks like she's having trouble breathing, probably a lot of diarrhea as well. And that's just important. I used that picture to show you that you would expect excessive parasympathetic nervous system activation, and that would cause the dumbbell's mnemonic, which is diarrhea, urination, muscle weakness, bradycardia, and then lacrimation and secretion and emesis. Now, something that you need to know about the physiology of irreversible cholinesterase inhibitors is that they they aren't irreversible to begin with. At first, they just bind onto the cholinesterase, inhibiting it, but after a while, it does something called aging, and that just means that it's permanently bound. And once it's aged, it's pretty much untreatable. That means no matter what we do, we can't bring that cholinesterase back. So what is the antidote? The antidote for this is going to be atropine. Atropine is an anti-muscarinic, so it just does the opposite of the parasympathetic nervous system. This drug is found from nightshade, for example, and this helps just reduce the symptoms. Another one that we can use is pralidoxime. Now, pralidoxime can only bind to organophosphates before they age, and this just pretty much prevents worsening. You could pretty much save the cholinesterase before it's too late. But again, once the cholinesterase has aged, there's pretty much nothing we can do. We can give atropine just to help with the symptoms, but other than that, there's nothing we can do. All right, moving on to anticholinergics, also known as muscarinic antagonists. Probably right off the bat, the most important thing you need to know, just like with the muscarinic agonist, is going to be the adverse effects of these drugs. And there's a mnemonic, just like there was before dumbbells. This one's got a different mnemonic. It's going to be hot as a hair, dry as a bone, red as a beet, blind as a bat, and mad as a hatter. And this is just the best way that you could learn that it causes an increase in body temperature, dry skin, oral mucosa, flushing, cycloplegia, and disorientation. Because you just imagine, like Alzheimer's, they don't have enough acetylcholine in their brain. Likewise, if you get an anticholinergic effect in your brain, you would also be pretty confused, similar to Alzheimer's disease. Now, questions may not mention that they took a muscarinic antagonist. They might not be straightforward and tell you that they took atropine. They might tell you they took a weed like Jimson weed, or maybe something like nightshade. And here's I showed you a picture of nightshade. And that's just a reminder that anticholinergics can be found in nature. And actually, some cultures, like Native Americans, are actually given the freedom to use these drugs recreationally because it's very tied with their culture. Moving on to specific drugs, let's talk about atropine. Atropine is the most commonly asked in question format. It can be used by an ophthalmologist. It helps with mydriasis. Mydriasis just means opening up the eyes. It's also the same drug that makes vision quite blurry. And this can be very helpful for when you're doing eye surgery or eye operations. Now, something of note is that you could also use it to slow down the heart in cases of arrhythmia. Moving on, let's talk about benztropine. Now, benz it sounds like a Benz, so I just think Parker Benz to help me remember that benztropine is used to treat Parkinson's disease. Another one is going to be glycopyrrolate. Glycopyrrolate, it looks like a sugar and spicy. I think of taste and stuff, and I think it works mostly in your mouth. So just think of a hot and dry mouth, and it reduces drooling during surgery. Moving on, these two I've never really seen anything asked about them, but they are still in your first aid, so I added them here. They're hyoscyamine and dicyclomine. They're antispasmics for irritable bowel disease, irritable bowel syndrome. And a lot of people will tell you that irritable bowel syndrome, nobody really knows what's causing it, but the only real treatment is just treatment of symptoms. We don't really know the cause. Moving on, these two are very important. Ipratropium. Ipratropium sounds like I pray, so I put I pray I can breathe again because that's exactly what it does. Ipratropium and tiotropium are both used for asthma and COPD that is resistant to albuterol. And you'll learn more about that in the pulmonary module. Moving on, we've got oxobutynyl, sulfenicin, and tolterodine. And these ones are very rarely mentioned on tests, but they're pretty significant for the clinical setting, and all they really do is they just reduce the bladder spasms, and this can be very, very helpful for a lot of paraplegics or people with multiple sclerosis, and you'll learn more about that in the neuro module. Finally, the last one that you need to know is going to be scopolamine, and scopolamine does have scope in its name, so you know it's going to work for the eyes. So eyes are like a scope, and this is just helps with motion sickness. All right, how do you use this information? I think the most important thing for your level is to remember the receptors and the drugs that work on those receptors, not necessarily the uses that you have to memorize for each of them. That'll come with time. You're going to learn those as the organ modules progress. So I guess you should focus most of your energy on just memorizing the receptors and memorizing the name of the drugs that affect each receptor. If you really must, I think the most important thing about each of these drugs is going to be the adverse effects. And it's really quite simple. If it causes stimulation and it gets out of hand, you would expect the dumbbells, which is the diarrhea, urination, muscle weakness, bradycardia, emesis, lacrimation, and secretion. So just think of just wet and dirty over here. If you don't have not enough parasympathetic nervous system, you would see an antagonist like atropine, and you would expect adverse effects like hot as a hair, dry as a bone, mad as a hatter, etc., etc. So once you focus on those, the receptors, the drugs that affect each receptors, and the adverse effects, you've pretty much got it all down, and you're set to go for the next 2 years.